Dr. Ajit Yadav. So I again thank Nomad who made this arrangement for this webinar, and today's topic is very different. Possibly it has a very big role in our clinical practice, and we would like to learn a lot from Tilo. And the topic is the role of compression therapy in differential fields of venous and lymphatic diseases. So
Thank you very much.
Dr. Tilo, now you can
I'm
share
not
this.
sure if you can learn a lot because it will be a rush of about 30 minutes. So you can't explain compression therapy in 30 minutes, but to give you a bit of an idea and also about the idea how the actual situation in India, you will see I calculated quite a few numbers for your country, and I hope you can benefit a little bit. So I'm gonna share my screen with you. Can you see my screen now?
Yes, yes.
We can see you. You can see the screen.
So can you see the first slide where it says the role of medical compression therapy in the field of venous and lymphatic disease?
Yes.
Okay. I'd like to start the agenda today. It's a short introduction. We'll talk about the CEAP classification. I will continue with the results from the Bonn Vein Study, and especially with the situation, what we have in India nowadays. Graduated digressive compression therapy will be the next point. The different standards, or actually the RAL standard, what we are following with manufacturing SIGVARIS garments. The different indications, which compression class with which disease, and last but not least, this is not anymore future thinking. It's actually on the top radar, the alternative inelastic wraps. And I think we'll have at the end Q&A session. Is that correct? Okay. So the introduction, and I need to cancel these pictures because I can't see the slide anymore. The treatment with compression devices plays a significant role in the world of venous and lymphatic diseases. And I think you maybe can agree to this. It's not a hypothesis anymore. It's really evidence-based. We have lots of studies. We have lots of published papers which actually confirm the benefit of these concomitant treatment. Of course, it's never just about compression therapy. It's always concomitant. And as I said, there are many scientifically proven studies all over the world which show the medical benefit of compression therapy. But, and this is the very important part, and it lays on our side, I mean, including all the stakeholders, in compression only works well and shows good results if it's actually correctly measured and correctly applied. I just had a conversation this morning with a prominent lymphedema therapist from Australia. We had a webinar this morning, and she fully agrees. She says, and that's my opinion as well, mistakes, they happen mostly because of wrong measurements. It's not our machinery which knits the garment in a bad or wrong way. No, it happens with the measuring. This is the point where it actually starts. And with this, I can't point it out enough. Education is a very, very important part when it comes to compression therapy. And we say a medical compression garment actually should fit like a second skin. If not, people are not happy, our patients are not happy, they will not wear it, they put it away. At the end of the day, there is no medical benefit, and on top of it, they spend quite a lot of money. So explanation, information, education, and good instruction of our patients is crucial. It is important. And as we all know, we are always talking about compliance. If all these rules are followed, then it usually leads to a much better compliance. Compression therapy is without question the basic of chronic venous insufficiency, lymphedema and lipedema. And I'm sure you might have heard about the STEMR library. The STEMR library actually confirms in more than 4,000 studies in the meantime the clinical efficacy of mostly graduated medical compression stockings. The STEMR library, as it's called so far, it will change the name, we'll see that afterwards. The STEMR library is the most comprehensive online collection of scientific resources on phlebology and compression therapy. And by the way, you can sign in free of charge under www.stemmerlibrary.com, and I'm sure you will find most papers what you are actually looking for. You get a lot of information out of this STEMR library. STEMR library is going to be restructured, and it will also get a new name. So in the near future, it will have the name STEMR Medical Platform. For those of you who maybe are not so familiar with it, it was initiated originally by Dr. Stemmer, and I think you all know him because of the Stemmer signs. So this is the Dr. Stemmer who initiated this. And then in 2001, SIGVARIS continued with this Stemmer library, and it's under the guidance or conducted by the International Union of Phlebology, so the UIP, and there are prominent doctors such as Hugo Parch, Eberhard Rabe, and Dr. Stemmer, but also Chris Latimer and all these well-known doctors. They are participating and they are writing quite a few articles, and it's being published in this STEMR library. So that's the STEMR library or STEMR medical platform. The CEAP classification, as you know, it's the document which was written by the American Venous Forum in 1994 to provide comprehensive objective classification. And in the meantime, we can say it's universally accepted and endorsed because it's a common language. All the stakeholders in the meantime know exactly what what we are talking about when we say C2 or C4. So everybody involved knows exactly what's about. And most published papers now, they're using all or at least portions of the CEAP system. And as we all know, it starts at Z0 and goes up to C6. So these are the pictures referring to these C's. C, as you all know, stands for clinical signs. So if it comes to an assessment, it's on one side the clinical signs, but it's also the E for etiology, the A for anatomy, and the P for pathophysiology, and all these letters put together makes the CEAP classification. And it starts with no visible signs going up to the worst case, what we all know, the active venous leg ulcer. I'd like to come back to the results from the Bonn Vein Study. As you know, this was conducted in 2002 in Bonn and the surrounding of Bonn in Germany. And there were 3,072 participants, mixed men and women from the general population, and they were investigating in the age group between 18 and 79 years. When we look at these different columns, Z0, so no visible signs of venous disease, there were 9.6% of these 3,000 people. But then C1, and here we are talking about the spider veins and the reticular veins, there's already a high number of almost 60%. And out of these 60%, there were at least half of them with a venous reflux in direction of the ankle. Then there's the C2 with the 14.3% with varicose veins, and the rest, as you can see, spread out between the edema C3 up to the active ulcer. And what also came out of these results, it is 1 out of 5 women and 1 out of 6 men show symptoms between C3 and C6. So these are the results from the Bonn Vein study. And I think having these results, I'm aware maybe we can't just compare it to the rest of the world, but in an average, I think it also counts for the majority of countries. So what I did, I had a proper look into your country, and I was actually looking at the population pyramid in 2020, and from the 1.4 billion people, what your actual population, at least the official number, I'm sure there's also a black number, but officially they're talking about 1.4 billion people. And looking into this age group, 18 to 79 years, in India at the moment, it's approximately 68.6, so almost 70% of the Indian population is somewhere in this age group. So what I did, I took the Bonn Vein study and I calculated the numbers. I mean, this is not very difficult to do, but with the almost 70% spread among these different percentages, it tells us that there is, with spider veins and reticular veins, the 60%, that means in your country, we are talking about more or less 567.6 million people affected. Or with varicose veins, official number would be 137 million, and so on. And at least there is, as an official number, there would be 1 million people affected with an active ulcer. So this is more or less the situation what we come across right now in your country. We are always talking about controlled graduated compression therapy, but what do we actually mean with this? It's the application of controlled graduated external pressure to the limb to reduce venous pressure within the limb. And of course, when I say graduated, I always mean graduated from distal to proximal. Ankle, we are talking at of 100% of pressure, and as it moves up on our legs, it needs to decrease in a way that below the crotch, we should reach a compression pressure of approximately 20 to 40% of what we have at the ankle. So with the measuring, what we have, we'll have a look at it later on. It tells you that the ankle measurement is by far the most important, because there the garments, they really need to fit, because we are talking about 100% of pressure. So to be effective, it is very important that compression be graduated. You can imagine if we apply a higher compression on knee level than down here, what happens? We would force part of the blood flowing downwards and part of it upwards. But this is not what we want. With the graduated degressive compression from distal to proximal, we really would like to bring up the whole amount of venous blood from the scratch, from the ankle upwards in direction of the thigh. Strongest at the ankle and decreasing in the proximal direction. So what are the goals of compression therapy? We would like to restore the blood flow velocity to normal, but we also would like to reduce or prevent edema, and we would like to reduce or prevent progression of venous or lymphatic disease. And in other words, I can also say we would like to compensate venous hypertension, what these people actually suffer from. Because as we all know, the elasticity of a vein vessel is more or less 200 times bigger than the ones of the arteries. So running into venous vessel difficulties is quite easy. I mentioned before the correct measuring, there's a spelling mistake, sorry, is crucial. And it is one of the most important parts. So we need to take it really serious. Ankle measurement, length measurement, different circumferences. This is the way how we measure. Not just this picture is the correct way. A patient can be seated if it comes to a knee-high measurement. So it's not mandatory that these people stay in an upright position. It's more to show how it actually works. It's not just about shoe sizes and maybe one circumference. No, the slide I would like to show you that it's important we are taking different measurements. So there's different circumferences and the lengths. And all these measurements at the end of the day lead to the point where we are able to determine the correct size. And of course, as we also know, the best time to measure is actually as early as possible in the morning, because if these people walk into your clinic or to the hospital or to wherever it is, point of sale, in the afternoon after a few hours driven by car or sitting in a train. Usually they're already suffering from a bit of a swelling. So what we highly recommend, if ever possible, if there is a swelling already, these people, they should sit down. Actually, they should lay down. They should be in a recumbent position. They should elevate their legs uh, above the level of their heart to make sure that the swelling, if it actually comes out, I mean, when we are talking about the lymphedema in an advanced stage, there will be no change, of course. But if it's venous caused, then usually the swelling can be reduced with putting these people in a recumbent position, elevating their legs, and that helps a lot. So we get to the accurate measurements. How does this work in your country, in India? As you know, Novomed Incorporation is our official partner in India. It's the general importer from SIGVARIS products. And Novomed is running offices in Mumbai, where is the head office, but then there's also Delhi, Bangalore, and in addition to these offices, they run together with 28 sub-distributors all over India. They are running the business. So each office having its own mobile fitter team. So these people actually go out and measure the patients and fit them with the accurate products. And with this service, Novomed and its sub-distributors, they are taking the responsibility and they actually guarantee the correct measuring and fitting. So we are quite happy having this service offered by Novomed and its partners. The stockings from SIGVARIS, what you come across in your market, is on one side the cotton range, and the cotton range is, I can really say, a premium product what we offer. Premium because we are using the finest cotton yarn what you can imagine for sensitive skin, ideal in hot and humid climate what you come across in your country. And when I say for sensitive skin, the cotton range is manufactured in a way, the knitting process is manufactured in a very sophisticated way that we can guarantee that there is no other yarn touching your skin than the cotton. So you can imagine you have the cotton is kind of running outside, and inside there is the elastic fibers. So the outside is uniquely cotton. That means cotton is touching the skin. And that's why we say it's specially made for sensitive skin. It absorbs moisture very, very quick. So when it's hot, when there is a high humidity, it wicks away the moisture from the skin. We can guarantee that we actually keep the skin as dry as possible. We also like to prevent from bacterial growth, especially between the toes where it's dark and humid. So the bacteria like these areas, of course. We prevent with the cotton range from these negative impacts. Also, if you have someone with an eczema, for example, or with very dry, flaky skin, with the cotton range, we are on a really, really good side to treat these people with. Another garment, what you come across is the traditional. Traditional is, by the way, the oldest ready-to-wear garment worldwide, the oldest one. It's a bit thicker. It's, when you hold it in your hands, it's a bit rough from the fabric, but it's very comfortable to wear. And the key features of these traditional stockings are actually, we have a fantastic pressure stability throughout the day. So throughout the whole worn period, the traditional garments, they do not lose pressure stability at all. Why this? Because the traditional contains natural rubber, but don't be scared. There's no natural rubber laying against the skin. Here we have the opposite from what we were talking before. Cotton, the cotton fiber goes round, is on the outside, where with the traditional, the natural rubber lays inside and it is covered by polyamide. So it's nothing that can touch, or the natural rubber can't touch the skin. Actually, it's elastan, not polyamide. Sorry. So elastan is covering the natural rubber, and no natural rubber, or as we also know, the name latex is touching against the skin. So we do not know allergic reactions in terms of latex at all. But the high pressure stability, what we have, especially with people in advanced stages with venous disease, lymphatic disease, maybe in the first stage, traditional is a fantastic garment, what you can use for these treatments. Then you come across with the Ulcerix. The Ulcerix, you might have heard, is a double liner system, especially for ulcer treatment. There we are talking about a understocking, and on top of this understocking, it's a medical compression stocking with compression class 2. So basically, during the day, we apply a compression class 3, and at night, the underliner remains on the leg, even in the recumbent position with elevated legs. It's a very good recommendation if these people wearing a light compression class 1, because there is a wound dressing normally. They don't scratch the wound dressing because there is the stocking, the comfortable graduated compression stocking with class 1 at night, and during the day they put on top the compression class 2. The results what we have, and we have the studies, the ulcer studies, active ulcers, we can actually provide the results where we can show the healing time of ulcers up to a diameter of 4 centimeters. We reach a healing time which is reduced down to almost half of the time if compared with people who wearing short stretch bandages. So this is the Ulcerix. And last but not least, we have the Top Fine Select. You might have come across with these stockings. We say it's a smart product range. It's pre-selected, as the name says. We do not offer all the styles. It's very selected as a knee-high sock, thigh-high, and a pantyhose, and that's it. It's unisex, it's for women and men. A difference is price-wise, it's on the lower end of our ranges. So the Top Fine Select is economically wise, it's quite attractive for so many people. How should compression treatment be? It should be strong enough to compensate venous hypertension, what I mentioned before. It should be strong enough that we can reduce or prevent edema, and it should be strong enough to cause regression of pathologic consequences in the tissue caused by vascular and lymphatic disease. But compression pressure should not be too high to not compromise the arterial supply. Patients should be able to put the stockings on by themselves. It leads to a better compliance. And of course, it's a symptomatic treatment. We never will say we can heal. This would be just silly. No, it's, as I said, concomitant way of treatment to prevent maybe from progression. The standards, what we are following is the RAL standard with SIGVARIS, and RAL is the German standard, the German Association for Quality Branding of Medical Compression Stockings. I think we can say most sophisticated and prominent quality standard worldwide for medical compression stockings. So whenever you come across with this label, it tells you this is RAL standard, this is a very high standard. And looking into the meaning of RAL, it's the German Institute for Delivery and Quality Assurance, and it goes actually back to the years 1925. And there is at the moment approximately 9,000 companies from all industrial sectors. So RAL is not just meant for medical compression stockings, not at all. They started with all different technical products where they were testing, and maybe one of the sectors you might be familiar is the colors. All the colors originally, they have RAL numbers. So that's where it comes from. In the meantime, as I said, there's many different technical sectors, they following these RAL standards. RAL actually guarantees the medical efficacy of the products, and for this reason, there is, in some countries at least, reimbursement, but of course, and unfortunately, not everywhere. I say unfortunately because I'm still convinced that that would be a tiny part of saving money in the health sector. But nowadays, we are everywhere talking about saving money in this area, and it would be a tiny contribution because I mean it's known if people actually wear stockings, they can benefit and it helps a lot, and maybe that would be a tiny little contribution, as I said, to save more money, because uh, reimbursing a compression stocking, of course, is still uh, less of costs than some other treatments. Content, defined pressure profile per compression class, characteristics, they have a look at the knitting construction, design of the heel. So these are all demands coming from RAL side, and we need to fulfill all these criteria. Minimal thickness of the yarns. This is, how can I say, all the ladies especially, they would like to have the stockings as thin as possible. They would like to have fashionable sheer compression garments, good looking garments. We try to do our best, but of course we stretch the limits sometimes to the end, because there is a limit in terms of thickness of the yarn. If we think that we need to fulfill compression class 3 or 4 with a very thin yarn, this would maybe break and we would not be able to provide these high compression classes with very thin yarns. But with a compression class 1 or 2, we actually offer quite thin stockings, good looking stockings. So nowadays they are looking in a way that from the outside, most people, they would not assume that it treats about a medical compression stocking anymore, because with the new techniques, with the new yarns, we are quite able to manufacture them in a very thin way. Product labeling, another part, very important. On this label, there's all the information we need to write down. So RAL forces us to do so. And of course, there's always the patient at the end, sometimes uncomfortable with the label. They like to cut it out, but unfortunately, sometimes they cut elastic fibers and then they are surprised if they create a leather on the stockings. So best way is to recommend them and to tell them not to cut out the labels. Test specifications, we need to test the product, the test procedure. We have a special testing machine. It's called HOSI for controlling the compression pressure on all levels of the stockings. So ankle, then at the beginning or at the end of the Achilles tendon, calf muscle, knee band, and so on. So this is what we need to provide. And this is how it looks like. The special machinery you can see with the clamps, we fix. This is a thigh high garment. We fix it, and then there is the cylinders. They extend, and at all levels, we need to measure the actual pressure from the garment. So as you can see, the demands from RAL, they are high, but we from SIGVARIS, we want to fulfill these criteria because we want to offer you high-end products. We want to guarantee that they're actually working, that they fulfill all these criteria. Compression class and compression pressure. I said we're following the German standard, the RAL standard, and with this, we have these 4 different compression classes, what you can see here. So class 1, the lowest, and class 4, the strongest, and it starts with 18 millimeters to 21 and so on. Maybe you might ask why there is a range, why we do not just define a compression class by, let's say, class 2 would be 25 millimeters of mercury. We are talking about textiles, we are talking about elastic fabrics, and you can imagine when you apply a medical compression stocking in the morning, cotton, top fine select, whatever, not the traditional, I said, it doesn't lose elasticity, but all the other garments, they are losing a little bit of their elasticity during the worn period, during the day. But when you put a compression class 2 stocking in the morning and you would measure with sensors at the ankle, let's say we would have maybe 31 millimeters of mercury. In the evening, before you go to bed and you remove the stockings, these stockings might have, measured again at the ankle, they might have 26 millimeters of mercury. So this is why we are talking about a range. A compression class still needs to be inside of this range in the evening. So this is also the demand from RAL. They are telling us, of course, they are losing a little bit, but they need to remain inside of this class. So that's why we can't just define it by one number. And we always give a range from 2. This is what it's about, the compression classes. Here again, you can see them. These are the RAL standard compression classes 1 to 4. So the different compression devices what we offer is, on one side, the typical and classic round knit without any seam, very comfortable, but also soft. And I said comfortable for the patient. Oh, Madonna. Then we have an ulcer kit. And I was mentioning this before, the double layer system where we apply compression class 1 on top of the wound dressing if there is an open wound with an active ulcer, but also with a healed ulcer, we're doing the same. And on top of it, during the day, we put compression class 2, so we reach approximately 46 millimeters of mercury at the ankle area. And this is what we need to heal an active ulcer. So basically coming up to a compression class 3. And on the other side, we are talking about flat knit. And as you can see on this picture, flat knit means you knit a fabric, and at the end of the day, you stitch the two ends together. And this is why we have a seam at the back. So the difference is obvious. I said the round knit is soft, is very comfortable. The flat knit, still comfortable because the seam is flat. It's not a sticking out like the little finger. It's a flat seam. But the difference is that the fabric of a flat knit garment is stiffer than the round knit. So you can imagine, if it comes to serious and especially lymphatic diseases, we need more wall stability. With a round knit, if there is skin flaps with awkward shapes of legs, skin flaps, tissue hanging downwards, we would take the risk with a soft round knit to cut into skin flaps. Not so with flat knit. Because of the wall stability, because of much more stiffness what we have with this fabric, kind of fabric, it more goes straight on top of these skin flaps. So with serious diseases, and especially with lymphatic or lipedema cases, we are on the better side using flat knit. And also you can imagine it's much more accurate following the contour of the limb, because we're taking many more measurements, and with knitting this way, we are able to follow the contour of all these shapes of the limb. Not so with the ready-to-wear seamless stockings. So this is the main difference between these two types of fabric. But then there is also other compression devices. Inelastic wraps, we'll see more in the next few slides. You're very familiar with short stretch bandages. These two products, in their key features, they are quite similar, because what we reach with a short stretch bandage, but also with the wraps, exactly the same, because as you can see, it's inelastic wrap. It's not long stretchy. It's short or almost no stretchy. That means with these two devices, we reach a high working pressure together with the activity of the calf muscle, of course, and we reach a low resting pressure. So when these people lay down, relaxed, no muscle activity, this is very similar with these two products. And last but not least, we all know the IPC, the intermittent pneumatic compression pumps. Some areas they're using them more. People can rent them, they can use them at home. Sometimes people have to go to the hospital to use them. So it differs quite a bit from country to country, from area to area. Coming to the indication, different indications, and it's a recommendation. It's not full stop, it's recommendation. Compression class 1, the 18 to 21 millimeters of mercury, we recommend them if it comes to heavy, tired legs with a tendency to swelling in the legs. And saying this, we can also think of occupational health, thinking of all people standing all day long or being seated for many, many hours in front of their computers at the desk, not moving their body too much. We know that, and if we are looking at ourselves, at our feet, after being seated for 7, 8 hours at the desk, usually we have a bit of a swelling, or standing for extended periods, same position, same. So here we could wear a low compression to prevent from this swelling. Prevention of thrombosis and embolism in immobile patients. Compression class 1, but what's known all over the globe is actually that the anti-embolism stockings, the white ones, as you know, they are fantastic during the stage at the hospital, but once these patients leave the hospital, they should actually wear the proper medical compression stockings with the compression pressure between 18 and 21. Superficial varicose veins without leg edema and so on. During pregnancy, this is another clientele. Compression class 2, varicose veins with mild leg edema after treatments, surgical procedures, but also sclero endovenous treatments to maintain treatment success, deep vein thrombosis, post-thrombotic syndrome, and so on. Severe varicose veins during pregnancy. This would be case for compression class 2. Compression class 3, active venous leg ulcers, recurrent venous leg ulcers, post-traumatic syndrome, post-thrombotic, I should see, yeah, and angiodysplasia. Indication for class 4 with a minimum of 49 millimeters of mercury at the ankle. It's always the ankle pressure. Irreversible lymphedema, stage 2 and stage 3. So as we know, reversible lymphedema is only during stage 1, the initial stage. Afterwards, it's irreversible. Then we're talking about severe post-thrombotic syndrome. And last but not least, we are saying that compression class 3 and 4 should actually be prescribed by you. So we never tell point of sales to sell these two compression classes without having any prescription. I think this is crucial. I mentioned the inelastic wraps before. There is a fantastic alternative. Wraps, they will not replace medical compression stockings, but it is a good alternative for an easier donning of high compression. It is a solution for all the non or poor treated patients in order to manage the disease by their own responsibility. Because we all know you have a patient who is bandaged, but lives, I don't know, 3 hours out of the city. Not easy access to you, to your clinic, or to the therapist. They're wearing bandages. Sometimes they're very uncomfortable, especially at night, because then people have time, a lot of time to think about. They are itchy, they are aching, sometimes they're painful. And what are these people doing? Quite often, and I can also talk from my experience during my hospital career, it happened so often that these people just ripped the bandages off. Result, no medical benefit, and everything starts from the beginning. So this is, I would say, the reality, what we quite often come across with. The inelastic wraps, how they look like, they follow the contours of the limbs quite well. They're easy to don because there's a stretch panel in front that goes on top of the tibia. So once they slide in and the device stays in place, and then they can easily unroll these wraps, the elastic straps, and close them with the Velcro hooks and loops. The material, it looks like neoprene, and neoprene you might be familiar with when it comes to divers wetsuits, for instance. It looks very similar, but it's not. It's called breathoprene, and it's really breathable. So we avoid having a wet or humid skin, and also these people wear an understocking with no compression at all, or there's transition liners where there is a slight compression at the ankle, and there is a complete liner where we actually offer slight compression on the whole socks. So they are very easy to don. If the patient is not able to do it on his own, then at least we can hope that there is family members who can help, but usually it's quite easy for them to do. This is the stretch panel which is in front, and we say it's like the third hand. It helps for an easy donning. What's the very special feature with our Compreflex, how we call it? We have a reproducible RAL standard compression pressure. So we actually have this, we call him AccuTab, and you can see the RAL compression classes are marked on these tiny little straps. We can apply them to the device, and we can adjust the straps to the prescribed compression pressure, what you prescribe, what is needed. So we have, with the inelastic wraps, we have a reproducible compression pressure. But sometimes if these people feel very uncomfortable during the day, and this is what happens, this is reality, the good thing about is that they can adjust a little bit. So self-management, self-control with the adjustability of the Compreflex is one of the big advantages for our patients. Which product, which solution? When we look at these legs, it's tricky. You can imagine if we have to measure these legs and manufacture the right garments, there would be solutions. We could knit, flat knit for these legs. But imagine what happens if these people, they having concomitant manual lymph drainage, for instance, or they're using the ICP, the intermittent pneumatic, the pressure pumps. They will reduce the volume of these limbs. Once they have a knitted garment measured to these circumferences, it's useless. After a week, after 2 weeks, when the volume is reduced, they can throw the garments away. They spend a lot of money on these devices and they are useless because they do not fit anymore. So with the wraps, for example, it's easier because we have the much bigger margin. We can adjust the compression pressure, and that means these people, they can use the inelastic wraps much better, and it's more helpful for them quite often than what we have with knitted garments. So self-management with wraps, edema often changes even after the congestion phase, and the wrap can be the first choice in those cases. Self-checking through own readjustment of pressure, varying without effort. After breast surgery, a wrap is often more comfortable than a flat knit garment. You know best if you have a woman with lymphedema on her upper extremity, and maybe the tissue already changed more into fibrotic tissue, hard, painful. It's very uncomfortable when we try to slide the ready to wear or even made to measure garment up on their extremities because they are very sensitive. With the inelastic wraps, it's much easier for them because applying is, as we have seen before, just slide in because then there is no compression at all. And afterwards, they adjust all the straps and adjust the compression pressure. So this makes it quite easy for these women. They're very flexible, so they're soft in the elbow inside, no movement restriction at all, and they're wearing an underliner, as you can see in beige here. It's a cotton liner to take care of their skin as well. Advantage wraps over bandages, temporary use. Yes, as I said, they can adjust it a little bit. Maybe they can take it off for a moment and put it back on. They would never be able to apply bandages by their own because, as we all know, and I had to learn back then how to correct apply bandages, and I still remember how tricky it is because to get to a proper graduated compression pressure with bandages, it's almost impossible because there's one bandage tour is strong, the next one is a bit looser, but the third bandage tour might be again a bit tighter. So we'll never have this properly and the digressive pressure. And this is why when we take off these bandages in the evening, we can always see all the imprints from the bandage tours. And that also explains a little bit. It's not, usually not a proper digressive, evenly spread digressive compression with bandages. Breathable and comfortable, I mentioned before. And looking at the costs, I would say here we are we have an advantage because with the adjustability, it gives the patient more options, and maybe they don't need to visit the clinic as often as they need to do with other devices. So there might be an advantage with the inelastic wraps. Just to make visible again the working pressure and resting pressure, when we apply it, we have a kind of low resting pressure. We have a very high working pressure, for instance, when we walk upstairs and when we are in a resting position, recumbent, no muscle activity, then it drops down to a low resting pressure. So this is how it behaves with the inelastic wraps. And to finish, I'd like to show you a few pictures. This patient, and I'm allowed to show this picture, I have the allowance of this lady. It's a mixture, as you can see, when you're looking at her feet, the foot dorsum, there is a bit of a swelling, but not too much. So it is a mixture of lymph and lipedema, because as we know, a typical lymphedema, there we have the swelling, also foot included, but with the typical lipedema, we have the swelling on the limb, but the foot normally is unaffected. So here we have a bit of a mixture, but when you look at this shape of this leg, you can imagine how tricky it is to measure for a knitted garment. And once this shape changes just a tiny little bit, the garments, they would not fit anymore. So here it's definitely a very good case for wraps. And you wouldn't think of that this is the same lady as you have just seen before. So with the wraps, and as you can see, these are the straps. There's also extenders, so we can add extenders. But this leg, after treated with or wearing the inelastic wraps, I don't need to tell you that the quality of life for this lady is changing for 360 degrees. She was not able to walk around in her apartment before. Now she's walking every day around the block, and she's improving and improving. So with wearing the wraps, she has a much, much better quality of life, and we can maintain at least this lymphedema or mixture, as I said, lymph and lipedema. We can maintain the volume more or less, and she's quite happy with it. Other pictures, these are cases from the UK. Lymphedema, again, it explains to you, you remember I was talking about round knit stockings, very soft and comfortable, but you can be sure that the round knit garment would actually cut into these areas. That means we would compromise the circulation, and this is the opposite from what we actually want. So we need a stiff fabric which has a good compression pressure and does not compromise any flow. This is actually a good idea, what they did. they used for an easier measuring, they used the glad foils. That's the foil, you know, from the kitchen. They just wrapped the leg at the beginning into this foil. Then it was easier to measure. You can see the marks on this glad foil, and so they could measure much easier. And then they determined the correct size of the inelastic wraps, and they took off the glad foil. So there's different ways to do it, but I think this is just to give a bit of an idea what is possible. And yeah, this again is this lady treated with Compreflex. It looks already much better than it looked before. And again, it's so much about quality of life for these people. And I think if we can help with whatever compression device, it helps them to get to another quality of life or back to a better quality of life. Measuring similar to the garments, circumferences and length for arms, for foot, for knee, thigh version. So we need to take all the measurements. So with the wraps, we can actually cover the entire extremity, and it starts with the foot, calf version, thigh version. So we cover the whole lower extremity and the whole leg. And I mentioned before the inelastic wraps for upper extremities. Yes, this, and I'm sorry, it took a bit longer. We started not on time, but it took me a bit longer. I come back to you, then maybe I can see the pictures. Okay, so thank you very much for attending. Yes, if there are
thank you, Dilo.
questions, feel free. I'm more than happy to answer. Are there any questions from your side?
It was a wonderful, informative webinar, I would say, because besides your product, we learned a lot about all over about the compression therapy and all. So, I will start my first question, and later my rest of the panelists can ask the question. Then we'll ask the questions from the audience.
Yes.
Okay. So my first question is: one has taken the measurements.
Yep.
So it is provided as a product which was sent to India, and how do these distributors prepare the stockings for a particular patient? We can't hear you. I think that was better with the headphone. Yeah.
Yeah. Okay.
So I think my question is how the distributors and the person who are designated to take the measurements, how did they prepare the stockings for a particular patient?
How did they prepare the stockings?
For a particular patient after
What do
taking the
you,
measurements.
but what do you mean? How were
Means
they prepared?
I think it's not a made to measure all the time, but we have a certain chart, and I think SIGVARIS has the largest number of series where we, based on the permutation and combination of legs, we fit in almost like 75 to 80% of the legs by measurement. If any uneven legs, then we do the custom measurement and then send it to SIGVARIS. It comes within 1 week measurement as per the patient's requirement. Sorry, Stilo, I had to jump in.
yeah,
Thank,
that's
thank you, Nanish. Yeah. it's actually the situation that we offer off the shelf before we need to move to made to measure. We offer 12 different sizes of the shelf regarding the circumference. So for instance, if it comes to a knee-high sock, the extra large plus what we offer, it goes up to a circumference below knee to 52 centimeters, or extra large plus for a thigh version means the measurement below the crotch, we go up to 85 centimeters. So this is quite a big circumference, but we are aware that we come across with even bigger circumferences. But with the 12 different sizes regarding the circumference, and we offer 3 different lengths. So calculating 3 by 12 makes 36 different shapes and length of legs off the shelf. So that's what Nanish just mentioned right now. We cover, I would say, majority of all different shapes of legs what we come across. If not, if we can't cover, then we move to custom made. Yeah. With the wraps maybe, and this is another advantage. Garments, we can't do the trial. I mean, if we would like to do trials with patients, then we need to have thousands of samples. And also in terms of hygiene, it's not possible that we just think, oh, okay, let's try maybe with a large or with a large plus. Once it's applied on the leg, it's already a bit overstretched. And if you would like to put it back in the box, in terms of hygiene and in terms of how it looks like, we can't do this. With the wraps, if there is uncertainty, if it's correct or not, it's much easier. A wrap, it's easier to use it as a trial because there's a few different sizes and the distributor maybe has packages of samples, and there he goes, and he can try two different sizes, and then they can decide. So even if it's too tricky to measure, with providing the trial, this helps a lot. Yeah.
Dr. Girish, Dr. Rachan, Shubro.
Hello.
Hello. So I had a question about the wraps. Basically, the thing with the wraps that we face is that, you know, for a limb where we're using a wrap, it's probably a limb where none of the stockings is fitting. That's what happens most of the time. Chronic venous problems, ulcers, and bad disease. So now I assume that in a lot of these patients, we have to use multiple wraps to fit the whole thing.
That's correct.
So the availability of sizes in India, is that adequate to meet all the different sizes we might need? How many different sizes do you have in wraps?
There is, with the wraps, I don't have the size chart right in front of me, but I can have a look.
So whilst he's gone, okay, he's back.
Back, yes. So with the wraps, we offer, and maybe you can see this page, it's 1, 2, 3, 4, 5 different sizes regarding the circumference, and we're offering 2 different lengths. So it goes from small via small max, we call it, medium large max, up to extra large. So there's different sizes, not as many as we need to offer with the knitted garments, because as I said, we have a bit of a margin with the inelastic wraps. The tighter you apply the straps, the tighter the inelastic wrap becomes.
There's a question from the audience about indication in acute DVT to prevent edema while the patient is on anticoagulation. So any opinions on that? When should we start the compression therapy after DVT, acute DVT?
The question is when to start the...
We lost you. I mean, I think you need to use a headset.
Because to listen, it's easier without the headphones, but then afterwards. So the question is when to start with compression therapy with patients suffering from DVT.
Acute DVT.
We actually, I mean, the earlier you can start, the better. This is as a general rule. The earlier, the better. Definitely. Yeah. Problem is what I mentioned, and unfortunately we come across so often and all over the globe. And I remember same I experienced here in Switzerland, the anti-embolism stockings, and there we provide an ankle pressure of approximately 18 millimeters of mercury, decreasing as they move up on the leg. This is fantastic, but the problem is that there is still a lot of confusion all over the globe. That is the meaning that these anti-embolism stockings, they are proper medical compression stockings, and they are not. They're really meant to be worn during the stage at the hospital. That means the patient is undergoing a surgery, for instance, mostly laying in bed, preparing the surgery. After the surgery, just leaving the bed for having a shower or going to the toilet and back into bed. Then the anti-embolism stockings, they are perfectly fine. But once they leave the hospital, during the daily life, the normal life at home, walking around, maybe working, going out in the garden, the anti-embolism stockings, they do not provide the pressure what these people actually need. And unfortunately, as I said, and I repeat it, there is still this confusion. And sometimes, and I know this from people, it's in a very good meaning that we tell these people, you can wear these white stockings, they will help you because of less costs. But in terms of medical benefit, they do not benefit at all because they should actually wear the proper medical compression stockings. And this is a bit of a pity. It still happens because of course, the anti-embolism stockings, they cost just a tiny little part from the medical compression stockings, but also, as I said, the medical benefit we can't guarantee.
I had a question for Shubhro specifically.
Tell me.
See, the classes that we talk about, class 1, class 2, class 3, that we commonly use. So about a long time ago, I discovered that they meant different things in different continents and different places.
Yeah.
And a lot of us still tend to prescribe in terms of classes. Now, that sometimes creates a little bit of confusion as to what compression we're actually giving. So what's your take on this?
So the way I work around this, I completely agree with you that actually as prescribers, because also you have to remember that different companies have different, not all of them will have exactly the same millimeters of mercury by what they mean by class 1, class 2, and class 3. So the best way to prescribe is to actually prescribe the millimeters in mercury that you want. But that is not possible for us. So what we do is, For example, I work with SIGVARIS, so I know exactly what my SIGVARIS distributor is going to prescribe. So when my patient is going to go and get a stockings from SIGVARIS, I'm okay to write class 2 or class 3. But if you are not sure, then it is better to actually prescribe the millimeters rather than actually saying class 2 and class 3. We all know what we mean by class 2 and class 3. There has to be a clear communication with the patient and with the distributor that what exactly, how much compression do you want? Like the, the gentleman was explaining, based purely on the indication, whether it's a grade, CAC grade 2, grade 4, grade 5, grade 6. Is it a heel ulcer? Is it not a heel ulcer? Is it an active ulcer, not an active ulcer? So you make that judgment based on the clinical condition, and it is better that you have in your head that what is the millimeter of mercury that you want, and so that you communicate that with the. Just to answer Arun's question, I think what you were asking, and I think you raised a valid point. See, a lot of this, when it actually comes to the ground reality, depends upon how trained the distributor is. Because you are saying that you want a grade 2 or grade 3. It is the distributor, at least in my practice, they actually go to the patient's home. And that's a great service. They go to the patient's home, they measure and they prescribe, they give the stockings. Okay. 1 out of 10 cases or 2 out of 10 cases, I will find that actually the compression was not adequate or it was excessive. It's not a problem with the stockings itself. I think the problem is adequate training and adequate translation of the knowledge that the distributor has in their practice when they are applying it on the patient. That's my take. But that's the point you were trying to raise, I think, Arun.
Yeah, so we have had the experience that they have actually, in fact, we also deal with SIGVARIS mostly for obvious reasons. Now we have found that they've even exchanged the stockings. If less than a month has passed or so, they have replaced the stockings with better fit. So we've not had any problem on that score. But I find that often that in
I must say
that way.
Yeah.
I'm
so
actually very
SIGVARIS
happy. Sorry.
No, I was saying that SIGVARIS is a little bit more expensive. There are a lot of cheaper stockings that are available. I actually tell my patients, I give them the choice. I said you can have a cheaper one, but you can have a more predictable, more expensive one, slightly more comfortable to wear. Material is better, nylon versus cotton rich versus nylon rich. So I give this to the patient, and then I leave it to the patient to choose, because not everybody comes from the same economic background. Somebody will say that I'll go with the cheaper stockings. I don't push it, but what I say is I do explain to them that why do certain stockings cost more than others. These are the reasons why it costs more. I do say that to my.
Thank you very much. And I'm actually very happy that you raised this question, because what happens nowadays with the confusion of compression classes and millimeters of mercury, I fully agree. We should move in the future to much more just talk about the millimeters of mercury than about compression classes, because nowadays with online buying, what happens? You can order stockings from all over the world, and for instance, the compression classes in the US, they are not the same what we offer. It's not the German standard.
Exactly.
It's a lower compression class. So the millimeters of mercury are not the same. And I really, I support Shura's idea that we should talk more about millimeters of mercury. And once you prescribe exactly what pressure you would like in millimeters of mercury, then there's no way to go around. So we could avoid more confusing with indicating compression classes, because they differ quite a bit. That's correct.
Any other? I don't think there are any other questions on the.
If any other, Dr. Girish, you have any questions? Dr. Viren? Otherwise.
Girish?
No, I'm okay.
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 Viru?
Thank you. Viru?
Yeah, I think yeah, no real question. Just one quick one, Tilo. Like lot
Yes,
of
please.
patients can't. Yeah, lot of patients in a hot temperature country like India doesn't go with above knee stockings, and we'll end up prescribing them
Below
below
knee.
knee. So because they can't wear, and even if they buy, they'll keep in their cupboards, and it's so better we go with the below knee. So what's your take, like below knee versus above knee in situations where they really can't?
Okay. There's a very clear statement. If there is not an existing disease in the thigh area, then there is no need to prescribe thigh version or pantyhose.
Compression.
So in terms of medical benefit, it's absolutely clear below knee is sufficient.
In fact, I have expressed it.
All the studies, they confirm the below knee version. If, as I said, no existing difficulties in the thigh area. And the argument, it's too hot, it's uncomfortable. This is what I try to explain with the cotton range. I mean, I used, and I said at the beginning, I was for 5 years in Australia, based in Australia, and we started with the cotton range over there. And I mean, Australia also has so many different climate types, and especially on the East Coast up to the north, very humid, cairns and all these places. And I had a visit at the vascular surgeon there in Cairns. And when I was there first, she said, no, you don't need to talk about these garments. They are too hot. They are uncomfortable. People complain. What I did, I gave her a pair of cotton stockings and I asked her to just try them herself. In the meantime, she is one of the best prescribers in Australia for cotton range because she's really convinced that people do not sweat. It's you need to know, and it sounds really funny, the content of our cotton range. And listen, it's only 14% of cotton fiber in these socks. But the way, and I tried to mention it before, the way the knitting process is, because they go around, the cotton fiber goes around, and inside there are the elastic fibers. We can cover with 14% of cotton and guarantee that there is nothing else than cotton laying against the skin. So with the less content, the low content of cotton, we can guarantee that the evaporation, once it's humid, the fabric, it evaporates very, very quick. And that means we keep the skin very dry. And with this quick evaporation, it actually leads to a cooling effect. So the cotton range has the properties wherein during hot days or humid hot days, it gives you more of a cooling effect, where when it's cold, winter times or colder days, it's the opposite. It gives you a warm feeling. So we have, with the cotton range, we have actually a fantastic thermoregulation. And it is because of this low content, because we used to say, thinking of all the sports clothes, t-shirts and that, 20 years ago, everybody was wearing cotton shirts because we said, this is comfortable. This is nice on the skin. But once you start sweating, you have just a wet lump on your skin. And this is uncomfortable because it takes quite a lot of time to dry. If the content is low, but just cotton touching the skin, the evaporation time is very, very short, and it transports moisture to the outside. So very similar to the synthetic sports close what we know nowadays. So it's highly recommended in humid and hot areas. I would prefer cotton than, for example, a Top Fine Select.
Sure.
With the Top Fine Select, I think we are much more prone to sweat compared to the cotton.
Yeah, nice explanation.
That's it then.
Thank you, Tilo, for
you so
this
much.
wonderful information. And just that this webinar was also live on YouTube, and I request for your consent because we are going to upload this webinar on our ISVIR channel. So I want your consent for this.
Thank you very much.
Okay.
Yes.
Okay. Thank you.
you.
Thank you,
Thank you,
ISVIR
thank
team.
you.
Thanks for giving
Thank you
us this
so much
opportunity.
for attending.
Thank
And
you.
I hope I will see you physically in India.
Yeah.
Once the flights.
Yeah, once there is flights again, then I might come over again. Yes.
That's
So
right.
thank you so much for your time. Thank you for
Yeah, bye.
attending.
Nanesh.
And
Thank you,
stay
Nanesh.
well
Thank
and
you, sir.
healthy.
Thank you, everybody.
Bye-bye.
Bye.
Thank
Bye.
you.
Bye.
Bye. Bye.
Thanks.
Hi, Girish.
Hey, you just got aboard.
Yes.
It looks like it.
No, today there is a thing coming. There's a
What?
cyclone coming.
I know.
Cyclone.
Yeah.
Yeah.
That's tomorrow. No?
You're preparing. Have you got enough stuff there?
No, so what I did was, I was upstairs in the terrace. I forgot. I lost the track of time because I was moving all my grape plants to safety. I've got 4 grape plants now.
Whoa.
The table grapes or wine grapes?
Cabernet Sauvignon.
We will. I'll let you know next year.
Okay.
So to be honest with you, nowadays I know more about grapes than the people who sell them. So when I say that, ask them that is this Thompson's, is this Vinifera? They say, no idea what you're talking about, sir. This is a cutting I've sent you.
So that means to say you're talking about table grapes and not wine grapes.
Yeah,
No,
absolutely.
Straightforward.
No, hopefully they're table grapes, hopefully. Because wine, I get it from you anyway. Why do I need to make wine?
Yeah, Girish has
It's all live on YouTube.
Okay.
Okay.
Tell
Sure.
Ajit to turn it off from YouTube.
Okay.
We can talk
Anyway,
other things
you
once in a while.
still got your thingy bob.
Yes. Chalo. Okay. Bye.
Okay.
Okay, bye
That's too
guys.
dignified
Bye,
to be
guys.
called that. Bye, see you.
And happy birthday again, Rochan.
Hey,
Thank you.
Rochan.
Thank you.
Happy birthday, mate.
Thank you.
Sorry. Happy birthday.
Okay.
Bye.
Bye.
See you around. Bye.
Bye.